Evening, hoping to get you guys get some questions answered for radiology. I know you all have so many questions, so let's get to chatting. I am just getting the evening all done, so I don't know what questions you guys have. I just came from a medical conference and it was fantastic. Turn this heat up in this house some because it is cold as the sun is going down. But yeah, we just finished with a medical conference called the RSNA, and 2026 is going to be fantastic, and I want you guys to be a part of it. So ask any questions that you may have about radiology, the profession. I've got my book here if you have any questions about it. But Rachel the Radiographer is a children's book, and I have the coloring book to go with it. But you got it back here. But let's talk about the conference because, y'all, it was amazing. Amazing, amazing, amazing. And I had a blast. Ooh, making a mess here. There we go. And I had a blast attending. This was my first time attending the conference. There we go. That book didn't want to sit up. This is my first time attending the conference, the RSNA. I don't know if you guys know what it is, but as radiology technologists, we have a global conference, and they're all over the world, but the one in Chicago is the largest, and it has AI, all type of new technology from vendors from around the world. When I say people were there from around the world, they were there from around the world. So please be sure to put some questions in the chat. Let's get going. I want to be on here for at least an hour, so you guys help me stay on here for an hour. Be sure, let's keep it on topic, respectful, and professional. So I'm excited to be here. Again, we got Rachel the Radiographer. Our children's book back there is great for a gift for kids, for schools, for libraries, however you want to donate it, however you want to give it. But some of the things I want to talk about today are pay. A lot of people want to know, like, how much do you make? I was having a discussion with a friend and they were like, you can really find jobs in radiology. I'm like, yeah. No matter like where you live, like for most of the time, you can find a job. Now, it may not be the schedule you want, and that's something totally different. It may not be the schedule you want when you first get out of school, but be patient. Your time comes. Sometimes you can find a work from home job straight out of school. Very unlikely, but it's not impossible, or a few years after you graduate. But we're going to talk about pay, like what professions within radiology and medical imaging pay the most. Also want to talk about how to make career advancements, how to advance in your career in a way that's strategic, but it doesn't take a long time, but it's also not going to be quick as well. And some of the things that I'm going to tell you that I did and didn't do may be of help to you. So please put your comments, your questions inside the comment section. I'd love to get to them. But I want to talk too about like cross-training, different things like that, the questions that most people ask me. And I'm going to grab my tablet because I've got some questions from TikTok as well that I'm going to pull over. Grab yourselves a copy of Rachel the Radiographer. Is right back there. You can get it in YouTube here. It is great for a gift, but it is a book by a radiology technologist. So how do you become a radiology technologist? You first go to school for at least 2 years here in the US. Our programs are minimum 2 years. You can even get a bachelor's degree if you would like. You can go to a master degree program. We have a few of those that have come up. So you have a choice. You can either get, and then they now have certificate programs again, but the catch for that is you must already have a degree or achieve one after completing that certification, because you cannot sit for your ARRT if you don't have if you don't have a degree. You have to have a minimum of an associate's degree in the US to sit for the ARRT. And without the ARRT, you cannot work in a hospital. You can't work not just a hospital, but you can't work most places. You can't work in most states because majority of our states have a licensure that is different from your ARRT. ARRT is not a license. It's a certification. It's a certifying body that makes sure ethically and professionally we are 100. We are taking care of just any old body is not doing your x-rays, what does the ARRT do for us? People wonder, why do we have to pay to have ART? Well, I'm going to tell you why. Just from my 24 years of experience, why you want an ARRT. Not only as a technologist for your job to have credentials, it's important for that. You want to have credentials that shows that anybody just can't do your job. They have to go through certain standards and curriculums, and not only go through it, they have to be held to those standards and curriculums for a period of time. Like, we have to take our ARRT education, CE continuing education credits, they call them. We have to do those every 2 years. And then after 10 years, certain people who have come into the field at a certain time, they have to every 10 years retest as a refresher. And if they fail, they have to go back and do some refreshers. And if they fail that shows they're not compliant. They're not standing up to the standards that are safe for patients. So if you or your loved ones are patients, wouldn't you want to make sure there is a governance body that makes sure that technologists who are giving radiation, injecting radioisotopes into patients' body, are actually keeping up with standards? And the other thing I don't think people realize how important the ARRT is that ethically, you want certain people to you don't want certain people to have privy to your health records and your personal information. Like, think about it. As healthcare professionals, we see people's social, we see their date of birth, we see their address, we see their next of kin, we see all of their private information. Like, those are things. You guys drop in the comments. Let me know if you have any questions. I don't want to just be the only one talking. I want to answer your questions or comments that you may have about some of the things I'm saying. But these are reasons why we have a governing body like the ARRT, because it's so important. Because if not, anyone will be putting radiation or radioisotopes into your body. Yes, you do not want that. So that's important. That's another reason why we have those things as radiology technologists. Now, when it comes to that, it also increases our pay, because now you have to take CE credits. You have to get a certain amount of education. Well, you have to be compensated for that. Then if you want to elevate your credentials, you now need to take more education by the ART, which means getting certain exams for, say, CT, MRI, ultrasound, nuclear medicine, radiation therapy. Those require extra schooling, extra certifications that you pay the ART for after getting a certain amount of education and clinical hours as well. So that's going to help your pay. Starting out as a diagnostic radiology technologist, you make good money for a 2-year degree minimum of that profession. Great money. Most technologists start out in the 30s, $30 an hour, 30 something, mid-30s, about mid-30s. I'm just giving a generic. Now, some places they start out at $40 an hour. And then some places they might start out at high 20s. Again, it just depends on where you live. But as a general rule, mid-30s for diagnostic x-ray. Well, once you have some years tacked on to that, you make even more money. You can make more money. But if you travel, you can become a travel technologist. So you could travel to different states, even to other countries, and work. Now, that's a whole nother video, other countries, because I'm going to tell you, I have friends that have worked in Saudi Arabia. And yes, crazy drunk Asian, is it possible to make around $100 per hour? Yes, it is. Even as a diagnostic radiology technologist. Again, you're probably a travel technologist. If you're a diagnostic radiology technologist making $100 an hour, that's usually someone who does travel work, because that means you're not at your home all the time. Thank you for the question. That means you're not at your home all the time. You have to travel. You're going away from your family. The hospital or the agency you're working for makes a lot of money bringing in travelers. The hospital pays a lot. So usually it'll be around... It can be around $70 to $100. Totally doable. It is something that many people are making out there. Usually when you get up into the certifications and then when you do travel work, it also depends on how you structure your salary, because you're going to get taxed on if you make a straight $100 an hour. But when you get into travel work, your recruiter, your tax professional, your CPA, whoever you use, you guys are going to discuss how you want to structure that, because there are some people that say, I don't want to get paid $100 an hour on paper, because then I'm going to get taxed on that, and the tax is going to be ridiculous. So the way a lot of times they structure it in a way to where you get per diem, you get housing, you get car, you get food allowance. Those things are not taxed. So that makes sense. So it may not look like you're making $100 an hour, but in other ways you do, to where you won't be taxed so heavily. I am a scheduler for the radiology department, Debbie, Emma says, and your videos have really helped me. Oh, thank you so much. I am glad. And thank you for being a scheduler. That is a hard job because you, as a scheduler for radiology, y'all, that's just not like anybody can do that. You have to really understand how the radiology department works, and each department is different because every scan does not take the same amount of time. If you're trying to schedule MRIs and you also do CT scans, people always get it, confused as to, it is hard. It is very hard because I know some people, they're like, I don't want to schedule for MRIs. I'll rather stay over in ultrasound or, whatever other department. So each modality to schedule for it is not easy. I just started 12 modalities. Oh my goodness. Wow. That's a lot to be, because you have to know how to schedule them. You cannot schedule, and you're new to the health industry. Oh, wow. I'm going to give it up for you, Debbie, because I'm going to tell you, knowing how to schedule nuclear medicine, I see the sweat coming down. That's a lot of stress, but you go, honey, you go. Because trying to schedule MRI, you got to know, okay, space it out because you can't schedule them every 5 minutes. Whereas CT scan, you could schedule maybe just lung screenings. Those, you could schedule those probably every minute or two. But then you can't schedule a regular CT with contrast or a CT abdomen pelvis the same as you can the other one. So just because it's a chest CT doesn't mean it's the same type of chest CT. So some take a little longer than others. So it's a lot that goes into being a scheduler for imaging, for an imaging department. A lot of people do not want to work in imaging scheduling because I'm going to tell you, it's a lot. So thank you, Debbie. I'm glad you found the videos helpful. I don't know if you know, we have a children's radiology book, Rachel the Radiographer. It is a kids radiology book, and it's all about radiology, written by me. And it's got beautiful illustrations on the inside, you guys. So please feel free to add this to your imaging department. It's a hardcover children's book. We have a coloring book to go with it too. Thank you. Welcome from Moscow. I would love to get in touch. CT, MRI, ultrasounds are tough. Yes, 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 yes. Thank you so much. Check out the book, Rachel the Radiographer. It is a product on this page. You guys grab one, gift it. Donate it to your local library, your kid's school, your kid's home library. It is an excellent ad. So when it comes to radiology, those are all of the reasons why you want the ART. It protects you from anybody having your information and doing whatever they want with it. There have been cases, I don't know if you all know, where people have made fake credentials and gotten jobs at hospitals, making fake ART credentials and gotten jobs at hospitals. Yes. Oh my goodness. And they've worked. Like somebody didn't do their job checking credentials because they were absolutely fake. Welcome from Canada. You start your clinicals in January. Thank you. Congratulations. I'm excited for you. You're in your second year of x-ray school and you're just starting clinicals. Oh, wow. So they don't start your clinicals like as soon as you guys start? That is interesting. So we got some US, some Canada, some Moscow. We got all kind of different people here. Hello to everyone. I would love to know. I'm going to be bringing some things to you guys in 2026. So let me know any type of content that you want to hear. And hopefully this was helpful. Talked a little bit about salary. Now, I want to talk really quickly because we're coming up on time about a medical conference I just went to that was global. So this fits right into what I was going to talk about, Song from Korea. Song from Korea says, with all the AI and remote MRI research coming out, do you ever feel like this job might become more limited in the future? Excellent job. How did you know I was going there next, Song? Oh my goodness. Okay, so I just came from one of the largest conventions, medical conferences, congresses in the world for radiology. It's all radiology, all imaging. And AI had its own section. So if you guys have not watched the video, be sure to check out my shorts. I've got recaps of everything. But I was with the company. I was there working with a company called AGFA. And let me tell you, what AI is doing and how they're using AI to not take the jobs, but to speed up work for technologists and radiologists. And I'll tell you what I've seen as an MRI technologist as well. The image quality by using AI has just, oh my goodness, it is amazing. I'm gonna see if I can show it to you guys here. Hang on, I'm gonna try to see if I could do a green screen. I got a green screen there. Okay, we are doing it. While I'm talking, I'm gonna show you all the image from the conference that I saw. And this is, I might give you guys some sneak peeks of what I saw. You guys want that? Let me know in the comments if you want some sneak peeks on here, some of the images I have not put up yet. Okay, so here is one. I'm gonna get out the way so you can see it. This image here is the original. This is a standard barium swallow. You see the contrast going down the patient's esophagus. So what we do is we do x-rays of patients. And we have a fluoroscopy machine to where the patient is standing on the scanner. We're taking live x-rays as they're drinking barium. So they're drinking the barium, and a speech pathologist, radiologist, if they're trying to make sure this is not aspirating, making sure it's not going outside, because you see the airway here, see that dark? That's going to be the trachea. That's how you breathe. That's how you breathe, and that's your spine right there. And then this is your jaw and your mouth and everything. So you're swallowing the contrast. See that contrast going down, 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 down. Now you can see it, but look how broad these shoulders are, right? Because you've got shoulders here. Remember, we're going this way into the patient with the x-ray beam. So if someone has a lot of tissue here, a lot of bulk muscle here, I don't, but broad shoulders. So you try to relax the shoulders as much as possible. And we're putting x-rays through here. We need to see that contrast go down, because this is where the trachea, the esophagus, all of that bifurcates right in here. But if you got broad shoulders, it's hard to see that as it is here. So what you want to do is give the radiologist a better picture. Look over this image. Look how much clearer that trachea is. So if contrast from the esophagus was leaking into the trachea, how much more clear would it be to see on this image than on this image? This is what AI, they are using AI for at AGFA and many others. I mean, even look up here in the eye area, the sinus area. Look how clear this is. I mean, look at the mastoids back here, and look at just everything is so clean and detailed without sacrificing image quality. And I've got videos to explain how they achieved this. And it's not some filter or anything like this. It's a proprietary AI technology. So this is AI being used for good, not for bad. And so what we're trying to do is make sure that contrast is not getting down. You ever swallow something and choke because it was going down your esophagus, and then you laughed and it came back up, or went into your esophagus, went into your throat? Oh my goodness. Oh my goodness. You cannot stop coughing. This is what happens to people on a daily basis. But this is what I want to go to. Remember, we're talking about the shoulder. Okay, can you hear me? Hope you can hear me. Somebody's calling me off my phone. I can't turn it off. I don't know how to do that. I need to learn. But as you can see, the shoulders right here are so broad, and it's white. Look how white that is. But if you go over here, look at that contrast. You're following it all the way down. All the way down. Huge. That is AI. Now, remember, we see the contrast in us as far as we can see it. Go over to the cleaner image using AI. And you're following it all the way down. So if there was any kind of aspiration, you can see it past the shoulders. Like, this is huge. This is huge. I'm just telling you, this is one way that AI is being used. Can I, let's see, or what's the best? Yeah, no, you can contact me here just like this on live. Better quality. Yes, song from Korea. Better quality. That's just one way. The other way I've seen is MRI scans. MRI scans, being able to do MRI scans without, let me take that image down because we're not talking about that anymore. But you wanted to know, would it actually, cut down jobs with AI? For me personally, seeing AI and MRI, it has not cut jobs down. If anything, it's created more jobs. Like, there is a shortage of MRI technologists. I'm telling you, there was not a shortage prior to the AI really kicking up in like 2020. But since 2020, the scans are a lot faster. And after I came from this conference, the scans are going to be even faster because the technology is just coming up. It is amazing. But I'm telling you, the scan time is going down, instead of MRIs taking 30 minutes, they're a lot shorter. They can either be 10 minutes, 12 minutes, some even 6 and 7 minutes. I've done one scan in 6 minutes. Huge. So imagine if you can do more scans in an 8-hour or 12-hour period of time. You're going to need more technologists to actually do those scans. Now, they do have remote scanning facilities. You are right. They do have remote scanning facilities, but the difference is with that, not everybody can remotely scan. There are certain technical limitations. People think it's working from home. It's not. Most of them are not from home. So people are like, I don't want to have to go into a facility. I already have to go in the hospital. What's the difference? I got to go into somebody else's facility. So you're not really working from home. Number two, the other thing that most technologists cannot do is work on multiple type of scanners. Most people only know one scanner, maybe two, possibly. They know one really well and the other, no. If you're working remotely, you got to know how to scan. You don't have anybody you can just say, hey, can you help me? No. You have to know how to figure, and you got somebody else putting your patients on the table. I'm just saying, those are things that can be challenging if you don't have the experience. You already may not know the machine very well, and every machine is different. I know GE, but I don't know all the softwares. I know Siemens. I don't know where everything is on all the software. So, it can be hard for you. I know Philips, but I don't know all the softwares. As software gets newer, they move stuff changes. I'm telling you, I'm working on a brand new Siemens now, and I'm like, where is this? I'm used to it on this other scanner, this other software. Where is it on this one? And they've got it somewhere else, and I'm like, why did y'all have to move it? I liked where it was before. But that's what an upgrade is called, right? That's what an upgrade is called. MRI is booked. Yes, it is. I saw, for example, NVIDIA is working on automated X-ray and sonography with voice control, and it made me kind of worried about the future of the job. I don't know who NVIDIA is, but automated sonography, I saw some things on sonography. Now, I did see there was I don't know what it was called, but it was supposedly is looking to replace ultrasound of the breast. But I'll say this, I don't think it's going to replace it because there's just a liability and not enough research. Many hospitals are not going to say, we're going to do this instead of that. It has to be a certain amount of research done. It has to make sense financially. Radiologists have to be willing, and hospitals have to be willing to take that risk. And technology always changes. So you're not going to see hospitals just up and say, okay, now let's all jump over to this. So there's something I saw there where it was a water-based, you could do it at home. I might have a video of it. I have to see. But you have to just make sure you follow my shorts, because I'm going to be doing like photo dumps, video dumps of my conference experience. And I've got some pretty cool videos. I took videos of vendors that I felt would be very helpful. I'm going to be also doing a podcast. I have a podcast. I don't know if you guys know. It's called A Couple of Rad Techs Podcast. The videos I have it's video audio. The podcast is actually here on YouTube, so you can catch it here. It's on Apple, Spotify, all of those. You can catch it anywhere. A Couple of Rad Techs Podcast. It's the top 5% radiology podcast. And what I'm going to do is create a series. This Thursday, you will have another episode coming out. But there's going to be several episodes about my experience at RSNA. This is the first time I went in 24 years. Why it's important to us as a profession. If it's important to you, if you're trying to elevate your career, if you're a radiology technology student, it's important to you. It's not just for radiologists to keep up with the technology. And that is what I learned at that conference. It's for networking. It's for understanding your value. Like, those are the reasons you should be going in person if you want to elevate your career. If you want to meet people, if you want, and yeah, you're going to have to spend some money. I know people say, oh my goodness, I'm not spending $1,000 to go to that. And I got to get a hotel. Yeah, but you also want people to pay you thousands of dollars. Show people why they should pay you thousands of dollars. Get out there and figure out, what in the world am I a part of? This profession, I'm learning still, y'all. I'm still learning. I'm telling you, my mind is blown. And I'm going to tell you, it wasn't like this earlier. Because of advancements in technology, I'm seeing a whole nother side of this profession. I'm telling you, I'm seeing a whole nother side. When I got on social media, nobody was really nobody was really talking about our profession in this manner. There were podcasts, there were content creators, but most of them did memes. They talked about either just MRI and MRI scary stories or what it's like to be an MRI technologist. Most people were ashamed to say, I'm a radiology technologist. I take x-rays. Yes, I do. Something I hung and it didn't last. Sorry. So I saw where there was a need, and people say, well, why do you call yourself a radiology technologist when you do CT, MR, those other things? Because that's what I started as. I am not embarrassed that I started as a diagnostic radiology technologist. That is the foundation. That is what gave me my ability to pivot my career. And I have multiple things I can pivot into, all because I started as a radiology technologist. So I felt like I needed to fill a gap in the content that was out there. And also that there were no books that were written by us about us telling the truth instead of making people scared or giving people a false narrative of who we were. People on TV shows, where's X-ray? Every TV show was like, where's X-ray? They're late. We need X-ray now. We're never late. We're always right there when emergency comes. We used to have an X-ray department in trauma center, so trauma emergency room. So we're always there. Like I'm always confused when I see that. I'm like, wait a second, that's not true. But anyway, I digress. Or people have these books that are trying to help kids not be scared of the MRI scanner. When I've worked at children's healthcare before, children are not naturally scared of radiology unless an adult has made them fearful. That's just my experience. So what I chose to do was to write a children's book, the first of many to come. You got another one coming in 2026, you guys. So get this profession uplifted. That is why I wrote this book, because I wanted children and their parents and guidance counselors, teachers, educators, school systems to know that this is a profession, like a real profession. We make good money. We're not rich. We go to work every day like everybody else, but we have jobs. We are not, thank goodness, in an unemployment line, because we chose to go to school for a viable career that people need in healthcare. If we had a profession that anybody could do, everybody would be doing it. And they're not. So, and this is the other thing I wanted to make sure in a profession, that it was inclusive of all of the modalities. I don't just talk about the 3 that I do. I talk about them all, and I teach people how they can go into all of them in a strategic way for their career. People may say, well, why do you talk about medical dosimetry when you're not a medical dosimetrist? I'm a radiology technologist. If I wanted to be a medical dosimetrist, I could be. That's the beautiful thing about going to school for radiology technology. I can pivot over to any of them. I could be a radiologist assistant if I wanted to. Get my master's degree in that. I could. I still might. I don't know. I might end my career off doing that. I don't know. I'm the kind of, if I spend money on education, it's got to pay me back. I do not want to pay it back just to say I have it. It has to pay me back. I'm very strategic in that manner. But I want to give people not just trendy content. So that's why I appreciate you guys on this live. Those of you that have commented, been on, giving me the hearts, watching my content. I could do content that gets millions of views because it's trendy, because it's eye-catching and poppy. But I know I have to be true to myself, which is give you content that is beneficial to you and your career for advancement. And also, this is a business as well. Content creation is a business. So I want to make sure I present myself in a professional manner, so that way you all understand this is coming from a professional person, not someone that's just out here to get some clicks. Okay. So, I appreciate the clicks. Don't get me wrong, because I want y'all to click and get this book. Oh, did I mention that proceeds of it go to scholarship? We'll be announcing, I'll have to make an announcement on my page, because the scholarship winners, I got 2, they've been waiting, but a couple people on the board we had some major health scaries that happened, and one just rang their bill for cancer free. So I did not want to interrupt their treatments with this. The scholarship had to wait. So that was the holdup in that, but we've got our 2 winners. Because of what I've been able to do in my content and sale of the books, I was not able to just give one person a scholarship, but 2. Thank you guys for buying the book, because that made a big difference for 2 people to get $500 each. And hopefully next year we can do even more. So thank you. Um, Moving to the US next month, and I'm excited. Any advice for me? I just posted a video that talks about if you want to work in the US as a radiology technologist. I cannot give you advice on how to come to the US and work. That's something you have to do with immigration and all of that. I don't make content on that. But I did make content recently about how to work as a radiology technologist, because people come from Canada. We go to Canada to work. We go to Saudi Arabia, Dubai, different places. But to come to the US and you didn't go to a US school, I have no way to help you on that. I have no clue. You definitely need to go through your immigration process, and they can help you with that. So sorry about that, but I can't help you with that one. What whisper of wisdom do you give us today? Oh, I saw Johnny Turner. That was funny. I had to read that a couple of times. That was funny. I love it. Money, 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 money. I love that. Thank you. Does it pay well though? Yeah, that's what I was saying. I mean, and I'm going to say this. Everybody's pay well means differently. So what pay well means to you could mean something totally different to someone else. That's why you won't really see me get on here and talk about. I do videos that say in California, this is the base salary. I get my information from the actual bureaus that report and actually do surveys. The ASRT does actual surveys, and they base these surveys at least based on ways that you can pinpoint as close as possible. Will I make that? So if you're fresh out of school, no experience whatsoever, but you have a bachelor's degree and you live in the Midwest, particularly say Kansas City, and you want to work at a big trauma hospital. Well, if you go to the ASRT's website, they have a whole data survey that explains to you someone with your education, your amount of experience in Kansas City working at a big hospital instead of an outpatient center usually makes XYZ amount of money. So earlier I said that average about $30 to $35 an hour, but that can be a little less. It could be a little more, depending. But a median range for a radiologic technologist straight out of school is usually about $30 to $35 an hour. That's what I've seen in the Facebook groups. That's what the data is showing. And again, it depends on if you work in an outpatient center Monday through Friday, no call, no weekends, no second shifts. Hospitals usually pay more than doctor's offices and clinics because you do deal with a little more risk, more population, different things at a hospital than you do at a walkie-talkie clinic or a doctor's office where you're usually just doing chest x-rays. All of that goes into how much you get paid. Some people are fine with that. That's why I say, does it pay well is a generic kind of question, because pay well to me and pay well to you could be two different things. I may have 5 kids and they all may be, and 3 of them may be in college. I may have a jet ski, a boat, love fancy vacations. You may say, I'm good. I don't have all those bills, but I like to travel. So our pay would be different, and our expectation of paying well would be different is what I should say. So I hope that makes sense to you. But the conference was amazing. Be sure to check out the videos because they're going to tell you all about my experience. And I'm going to talk more about career pivoting using these type of conferences. So thank you guys so much for the show of support. Be sure to check out Rachel the Radiographer, our children's radiology book. And this is a fun kids book. Again, colorful, well illustrated, hand illustrated, no AI. Be sure to get you a copy of this hardcover book. And thank you guys.